Hello to all the McArdleites in the UK. 320, no, 332 of us at the moment. I think I know almost all of you, one way or another. So this is going to be the annual review for 2020, what's been happening in the McArdle's world in the UK. Of course, it's been a very strange year because of COVID-19, which has really messed up the clinic, which has had to go to online and telephone appointments rather than face-to-face for a large part of the year. And of course, it's meant disruption to a lot of the McArdle's and AGSD-UK activities and other associations around the world, as you'll hear later on. Don't forget that on our website we have news items which pop up every week, sometimes two or even three a week, and the McArdle's news does get included in there. Obviously there's not a huge amount. The news covers all the different GSDs, but keep an eye out for news items on the website. And of course in the magazine we produced 2 issues last year, did we? Oh, I'm not sure now. 1 or 2 it's been, and there's always some McArdle's articles in the magazine, Glisten, and that comes round by email unless you're a paid up member, in which case you get a printed copy sent in the post to you. During the year, we've actually had 16 new patients diagnosed, or should I say, 16 new patients come to the attention of AGSD. Amazingly, some of those are newly diagnosed, as you'd expect, but some of them have been diagnosed for anything up to 40 years and never been in touch with us. I think rather like me, when I was diagnosed in 1980, I was told that I was about number 50 in the world and people didn't know much about it and there was no support, and that was the end of that for me, so I didn't look. It was only when a friend looked almost 20 years later that I discovered there was a McArdle's clinic that had just got started and was running 2 sessions a year at the time. So yeah, there are still people out there who've been diagnosed for many years and had no support at all. So let's hope we find the rest of those. We started the year, the first sort of activity really for me was the annual review at the McArdle's clinic. We've got the patient liaison panel, the PLP, which has 6 or 7 members, and we are there to help bring the patient view to the clinic, to help them organise their services appropriately. Yeah, that meets twice a year. If anyone's interested in joining, do let me know. The meetings, of course, are at the clinic in London. We have had one online during the pandemic. So yeah, let me know. Another thing was the T-shirt. You probably have seen, I hope, and a lot of you ordered the Second Wind is My Superpower T-shirt, which we got produced really under IGSD. It had the IGSD logo on the back, but it was produced here in the UK and was sent all around the world. There were a few hiccups with the cost of shipping internationally and unfortunately taxes. So sometimes some poor people ended up paying twice as much as they thought for their T-shirt. But anyway, it went well. I think we did about 100 T-shirts that went around the world. And anybody in the UK who still would like one, do let me know, because I got about a dozen extras made. So obviously in a variety of sizes. So I can't guarantee that I'll have one in your size, but do let me know and I'll see what I can do. Then we move on to the walking course. It was going to be our 10th year. The walk over Wales was 2010. We started the walking courses in 2011. So this was our 10th year. But of course, early in the year, it was obvious that the pandemic was going to cause disruption. We had the accommodation booked in North Wales, and I kept it open. That we promoted the course and took inquiries. We had enough inquiries to fill the course, but as the pandemic continued, and even through the summer when things were much better, it became clear that we wouldn't be able to meet the requirements of the social distancing within the accommodation that we had, and also within Wales, probably in England as well, but in Wales, there was no way we could have people coming from sort of 14 different households all meeting together under one roof. We could get together for an outside walk, I think, at the time, but we were sharing accommodation and one dining room and one sitting room and so on. So it just wasn't possible to do it. So it was cancelled. But next year we're lined up for 2021, lined up for going back to Pembrokeshire again. It will be in July. We're going to have the adult course and again the children and parents event, and they will actually overlap so that the children will get plenty of opportunity to meet adults with the condition. So anybody interested in that, do let me know. I'll be getting the details up on the website very soon, but I think I might have the dates there already. If not, drop me a line and I can let you have the dates. Just scrolling through my notes. Oh, you might like to know that at the time of the walking course, the Thomas Bush family, that's Bronte Thomas, who's got McArdle's, they decided to still have a family holiday and they came to Wales. They couldn't stay with me, of course, with the requirements, but they stayed locally, and we met up and did some walks. I was able to show them around some of my walks in the Mid Wales area where we've not had a walking course in the past, and we were very lucky with the weather, and it went well. It was nice to do some walks with them. Of course, the things have been cancelled elsewhere in the world. Not only our conference obviously cancelled in the UK, being replaced by this winter season of talks and events, but also the American conference, which I often go to, and the German conference, which I've been to several times. I dare say lots of others were cancelled, but those are the ones that I was provisionally going to attend. And in fact, in Germany, they were going to run a walking course again, and I was going to go. That's for the second year that they run a walking course there, and that also, of course, had to be cancelled. One of the highlights of the year, which is not quite AGSD, but I was involved, and Dr. Quinlivan, Professor Quinlivan from the McArdle's Clinic has been very much involved, was instrumental in establishing Euromac consortium of clinicians and researchers across Europe, and setting up a registry for patients. And now we've had two major papers published in journals, one on the establishment and structure of the registry and how the whole thing worked. It's obviously quite a big initiative across Europe, and another paper analysing the data on the approximately 350 patients who've been entered into the Euromac Registry. I'll be publishing, probably in a news item I'll put on the website, will be links to the papers so that you can see them. particularly you'd be interested, I think, in the data one, not so much the structure. And of course, if anybody isn't in the Euromac Registry, then do please get in touch with me. I can give you details. If you attend the McArdle's clinic, they will put you in the registry. But even if you see specialists anywhere else in the UK, please do take one of the leaflets I can send you and ask them to put you into the registry. It really helps if we've got more and more data on more and more people. Great. I think the last thing I want to mention is that IGSD has been very busy, and the president, Dr. Stacey Reason, will be doing a presentation during the winter season about the activities of IGSD in the last year. But I just wanted to mention in particular the clinical practice guidelines. This is something that it actually started with the AGSD in the US, asking Stacey. She's, by the way, she's on their medical advisory board, and they asked her if she could help organise clinical practice guidelines for GSD 5 and GSD 7, that's McArdle's and Tarui, because they'd previously sponsored clinical practice guidelines for other GSDs, and they were keen to see that we could do it as well. And Stacey and I have been working very closely on it. We've got together a consortium of, I think it's 15 clinicians around the world, particularly in Europe, clinicians and researchers, and they've all been writing their particular sections, and we're in a second draft stage, and we hope that those are going to be published next year. So that will be really improving the collation of information on diagnosis and management of McArdle's and Tarui. So it's something to look forward to. It's not really aimed so much, obviously, at patients. It will be a bit technical, but it is very much aimed at doctors from GPs through to neuromuscular consultants to improve the understanding of McArdle's, and particularly to get more people diagnosed, we hope. So I think that wraps it up. Just remember, if anybody's got any questions about what's going on with McArdle's in the UK and worldwide, do please get in touch. I'm sure you've all got my email address. It's on the website.